Hi, I'm live here with Troy Townsend, RN, and Healing Director of the Gilead Healing Center. How are you today?
Doing terrific.
Wonderful. I have some questions for you, Minister Troy, about your ministry and the center. Glad you're doing well today. I'm going to start with the questions. Why did you become an RN?
Well, my wife and I love helping people, and we were ministers many years ago. As our children became older, we didn't want to travel as much, so we said, well, let's get into a field where we can help people and stay close to home. So we've been RN now for myself 5 years, my wife 7 years, and really just love helping people.
Cool. Why did you become the healing director at Gilead Healing Center?
Well, Gilead was built in 2002, dedicated for two reasons. One was for alternative therapies, chiropractic, nutrition, muscle testing, other complementary therapies, I should say. We want to come alongside the medical community and assist them in helping people. So we're not against, we're for. We believe in the medical profession. I'm an RN. We have a medical doctor on staff here, an MD. The other side is dedicated to the spiritual part because we recognize this holistic need for care. And in our prayer side, we have a couple things. We do services where we practice praying for people, but it's a very conversational type thing. It's very relaxed. It's a very non-threatening atmosphere. Then we do a smaller group setting where we have, we call the healing rooms. This is our private prayer sessions. This is where people can come in who are sick or who have a mental health issue, depression, suicidal ideations. And we work through forgiveness therapy. We talk with them, we pray, and we're seeing tremendous results. We're seeing people saying, I was depressed for years. I had suicidal thoughts. I don't now. So once again, we see this as a complement to existing mental health therapies. So Gilead is for the city of Lansing. It's for people who need physical healing, mental health healing. It's complementary and it's very effective.
Cool. What is the greatest miracle you've seen?
Well, so my story is this. It's a little unusual. I was raised and I knew about God, but I knew he existed, but I wasn't really connected to him in a personal way. And once I made that real personal connection, a lot of things began to open up. And we began to pray for people, and a lot of them were healed. Not all, but many. And we realized, okay, this is not us, this is God. And my father was sick most of my growing up. I remember going to Mayo Clinic as a kid for family vacation. And I mean, he was in the hospital a lot. And once we discovered the power of prayer and began getting around people who understood it, he was healed of many illnesses. He had chronic shoulder problem, healed. For years, all he could eat was cottage cheese and peaches. That's what I remember him eating 3 times a day for years. And after receiving healing prayer, he could eat anything he wanted. It was remarkable. So as a young boy, I saw this. He had constant vertigo, which is why we went to Mayo Clinic. They couldn't help. And he was healed. This launched us into healing ministry. And I can tell you about a very recent miracle. This was last weekend in Jackson, one of our daughter churches, Mount Hope Community Church in Jackson. Through the laying of hands prayer, a woman said that her breast cancer tumor was completely gone, and she was completely shocked. She could feel it. It was very large, and she said, it is completely gone. So that was a very big miracle. And then you have a lot of people healed of shoulder problems, back problems, knee problems, digestive. But then we're also having what we consider the higher level results too, where we're having some people who have partial to up to 90% deafness, having hearing restored, taking their hearing aids out. We had a woman who had blindness in her peripheral vision, which was restored. So, so these are some of the great things that God is doing at Gilead.
Awesome. Thank you. What are the alternative healing methods that you encourage and why?
Well, everything we do at Gilead is a complement to established healthcare. So on the medical side, we believe in medication. We believe in doctors. I am an RN. So, but as a complement to that, we encourage proper nutrition, exercise, chiropractic, really whatever it takes to get the person well. And then on the prayer side, we practice forgiveness therapy, for example. Very effective, very effective. And then we practice healing prayer, which is nothing more than just touching a person's elbow, shoulder, and just saying a very simple prayer, asking God to heal them. So this is the main focus of the prayer side.
What is the best way to be healthy?
Well, really, it's the whole thing, isn't it? It's seeing your doctor regularly, it's exercising, nutrition, and of course prayer. And studies have been done on the effects of prayer and healing, and it is definitely worth implementing and considering. In fact, I read one study where they said many patients wish their doctor would pray with them. You know, the healthcare professionals are esteemed. Nurses, PAs, NPs, doctors, mental health care professionals. You are esteemed. People look to you. They respect you. If you say something's good, they're likely going to believe you. So I encourage healthcare professionals to, step out and look into some of these other things, especially, saying to a patient, could I pray with you? And see what happens. Something good could happen.
Amen. What is the best way to communicate with consumers from medical professionals?
And let's see, I'm not quite sure what the question is.
The best way to for medical professionals to communicate with consumers.
Yeah, that's a good question. Well, of course, one thing is not using medical jargon. Of course, communicating in simple terms. We like to think, if you can communicate it to a 10-year-old child, then that's a really great way to communicate. And just keep it simple. I think that's a big thing. And I think when in verbiage, less is more, not overwhelming the patient. And I think another big thing is when you really care about that person, it really comes through. Looking at the patient, a meaningful touch on the shoulder. How are you doing? Good to see you today. And how are your kids doing? Just if you can make a quick connection in a caring way, people will trust you. And it makes our careers more meaningful when we can make a connection. And because we really all got into this to help people. And so in the busyness of building a business, building a practice, we want to maintain that. Why did I get into this? Well, I want to help people. And for me, it's maintaining that, always showing compassion and, what's the best for this patient.
Thank you so much. You have a great day.
Yeah, it's my pleasure. Thank you.
Bye.